Today we will talk about dizziness when you turn your head and how to do one thing first. Stay safe. Let me start with a familiar moment. You are in a store. Someone calls your name. You turn quickly, and suddenly you feel the world tilt. You grab the cart. Your heart races. You think, I'm going to fall. That experience is real, and it deserves a careful explanation. But I will not sell you a single secret cause, because dizziness in older adults has many causes. Some are benign, and some are urgent. Before we do anything with the neck, we need clear stop rules. In lower voice, if you have dizziness together with any of these, new weakness or numbness on one side, trouble speaking or understanding, new vision loss, fainting, chest pain, a sudden severe headache unlike your usual, call emergency services or seek urgent medical care. In normal voice. Now, if you do not have those red flags, we can discuss a common pattern. There is a type of dizziness sometimes linked to neck pain and stiffness. It is often called cervicogenic dizziness. Important. It is a diagnosis of exclusion, meaning clinicians consider it only after ruling out other causes, including inner ear and neurologic problems. And yes, some studies suggest that targeted physical therapy and manual therapy can reduce symptoms in some people, though evidence quality ranges from moderate to low depending on the approach. So what might be happening in plain language? Your balance system uses three streams of information: your inner ear, your eyes, sensors in your muscles and joints, especially the neck. When the neck is stiff and painful, those sensors can send noisy signals. Your brain may feel unsteady, foggy, or off balance. Now there is a second, much rarer issue. Some people get dizziness, near fainting, or visual symptoms specifically when the head is turned or extended in one direction, because a vertebral artery can be mechanically narrowed during that movement. This is called rotational vertebral artery syndrome, or Bowhunter syndrome, and it is rare. It requires medical evaluation. It is not a DIY diagnosis. Also, let's be accurate about anatomy. The vertebral arteries are part of the posterior circulation and contribute roughly around 1/5 of brain perfusion in many references, not all the blood to the brainstem. So we avoid dramatic claims and we focus on safe, practical steps. Now I'll give you a gentle, senior-safe routine that targets neck stiffness and coordination. This is not a replacement for medical care. It is a low-risk option for many people, if done gently, seated, and within comfort. Safety setup. Sit in a stable chair with a backrest. Feet flat on the floor. If you're unsteady, have someone nearby. Move slowly. No jerking. No forcing end-range positions. And one more rule. If any movement makes dizziness worse, stop and sit quietly until it passes. If it repeatedly happens, talk to a clinician. Step 1. Stack and breathe. 30 seconds.
Sit tall. Imagine a string lifting the crown of your head. Relax your shoulders down. Breathe in through the nose for 3 seconds. Out for 4 seconds. Repeat 3 times. Step 2. Gentle chin glide, not a big tuck. This is not a hard double chin. It is a small glide. Keep your eyes level. Move your head straight backward a few millimeters, like you are making space at the back of the neck. Then return to neutral. Do it slowly 8 times. If you feel pain or dizziness, stop. Why this can help? It trains deep neck stabilizers and reduces forward head strain without extreme rotation or extension. Step 3. Side of neck ease. Very gentle. Place one hand lightly on your upper chest or clavicle area, not pressing hard. Now make a tiny side bend. Bring your ear slightly toward the opposite shoulder. Do not look up. Do not crank your head. Hold 15 to 20 seconds while breathing slowly. Switch sides. What I am not claiming, I am not peeling fascia off an artery, and I am not promising a blood flow rush. If you ever feel a sudden worsening, stop. Step 4. Eye-neck coordination, a safe version. Keep your head still. Look right with your eyes only. Hold 2 seconds. Look left with your eyes only. Hold 2 seconds. Do this 6 times. Now keep your eyes looking forward and turn your head a very small amount right, then back to center. Small amount left, back to center. Do this 6 times. This helps your brain coordinate visual and neck signals, often a practical target in cervicogenic dizziness discussions, without dramatic claims. Step 5. Quiet strength isometrics, low effort. Place your palm on the side of your head. Gently press head into hand at about 20 to 30% effort. Do not let your head move. Hold 5 seconds. Breathe. Repeat once. Switch sides. Now palm on forehead. Gentle press 5 seconds. Hands behind head. Gentle press 5 seconds. If you have uncontrolled high blood pressure or you feel pressure in your head, skip this and speak with your clinician first. Step 6. The real-world safety close. Even a perfect neck routine will not replace proven fall prevention strategies, strength and balance training, medication review, vision checks, and home safety changes. Global guidelines emphasize that strength and balance exercise reduces fall risk in older adults. Also remember orthostatic hypotension, dizziness when standing up. This is very common in older adults and is linked to falls. If your dizziness happens mainly when you rise from sitting or bed, that is a different path to evaluate. So, here's the clean takeaway. If dizziness is new, severe, or comes with neurologic symptoms, treat it as urgent. If dizziness is persistent and affecting life, get a structured evaluation. And if neck pain and stiffness are part of the picture, gentle, seated, low-range exercises may help some people without dangerous promises. If you want, you can repeat this routine once a day for a short period and track 2 outcomes: how often you feel dizzy and whether you had any near falls. If it worsens, or if you need to hold on to walls, talk to a clinician or physiotherapist. I'm Professor Kalmykov. Take care of your balance, carefully, scientifically, and safely.